Today in the news, we will discuss more study results presented at the 2015 Gastrointestinal Cancers Symposium and a new resistance mechanism in melanoma. We will also play a special video clip from the Joan Lunden interview with Roy Firestone. Hello and welcome to UncLive News Network. I'm Laura Jones. First, from the 2015 Gastrointestinal Cancers Symposium, updated findings were presented from the Keynote 012 trial, which looked at the PD-1 inhibitor pembrolizumab for the treatment of several types of cancer. Dr. Kei Muro from Japan describes the key results related to 39 patients with gastric cancer whose tumors express the PD-L1 antigen.
This is our first PD-1 antibody for gastric cancer treatment trial. Its response rate is 22.2% by a central radiologic review. This is very high rate, I think, and most surprisingly is response duration is very durable, and progression-free survival, median progression-free survival is just only 1.9 months, but median follow-up duration approximately 8.8 months, now median overall survival has not been reached. Toxicity profile is very feasible and manageable.
In a keynote presentation on PD-1 inhibitors, Dr. Ronald Levy from Stanford University was enthusiastic about immunotherapies and cancer in general. He states that we have found out that we can use the immune system to kill cancer, and this includes gastrointestinal cancers. Next, we'd like to highlight two studies on pancreatic cancer presented at the symposium. First, Dr. Lisong Chen from Taiwan presented results on the per-protocol population analysis of the Phase 3 Napoli-1 three-arm trial in patients with pancreatic cancer. The per-protocol population included patients who received at least 80% of the target dose of therapy in the first 6 weeks and did not violate any inclusion or exclusion criteria. The trial assessed efficacy of either MM398 as a monotherapy or MM398 in combination with 5-FU-LV. These two regimens were compared with the control arm consisting of 5-FU-LV alone. This additional analysis confirmed the favorable overall survival of the combination therapy arm over the control arm. Dr. Chen explains that this result was not unexpected in the per-protocol analysis, but what was surprising to the researchers was that it also significantly improved overall survival in the non-per-protocol population versus the control arm. The study also found that MM398 as a monotherapy did not show a statistically significant improvement in overall survival compared with the control arm. In November 2014, the FDA granted MM398 plus 5-FU-LV a fast-track designation as a second-line treatment for patients with metastatic pancreatic cancer based on data from the Napoli-1 study. Thus, final submission for review is expected during the first quarter of 2015. Clinical trials have found that frontline treatments with the combination of gemcitabine plus nab-paclitaxel has demonstrated efficacy for patients with metastatic pancreatic cancer. Unfortunately, the survival benefits came with reports of several side effects, including neutropenia, anemia, and fatigue. A retrospective study headed by Dr. Tanios B.K. Saab from The Ohio State University Comprehensive Cancer Center found that adjusting the administration schedule of the combination therapy from weekly to every other week significantly reduced side effects without impacting efficacy. The review found that grade 3 or greater toxicities were markedly less with the less intense regimen. Dr. B.K. Saab explains that shifting this treatment to every other week gives the immune system time to recover between chemotherapy sessions and results in less overall toxicity. It also means fewer visits to the infusion center to receive chemotherapy. The less intense treatment schedule also had a longer median overall survival and median progression-free survival. In addition, the change in dosing reduced patient medical costs by $5,500 per month. Combination therapy utilizing both BRAF and MEK inhibitors is a very effective treatment for metastatic melanoma. However, as with other targeted therapies, patients on the BRAF-MEK combination frequently develop acquired resistance. A new study led by UCLA's Johnson Comprehensive Cancer Center discovered the mechanisms of resistance related to the BRAF-MEK combinations. The study was published online on January 15th in Cancer Cell. Corresponding author Dr. Roger Lowe from UCLA explained that the team took 43 tumor samples from 15 patients, first before they received the new BRAF-MEK combination, and then after they relapsed on the combination due to acquired drug resistance. The researchers found that patients who developed acquired resistance had highly unusual genetic changes in certain key cancer genes. According to the article, the double drug resistance associated genetic configurations significantly altered molecular interactions underlying MAPK pathway reactivation. Dr. Antoni Uribas, also from UCLA, stresses that understanding the molecular basis of these resistance mechanisms can lead to the planning of new treatment approaches to disable these mechanisms. Finally, we are so pleased to be able to share an exclusive clip of a special interview with Joan Lunden and Dr. Patrick Borgen, a surgical oncologist from Brooklyn, New York, and chairman of the Miami Breast Cancer Conference. Joan Lunden will be the keynote speaker at the upcoming 32nd Annual Miami Breast Cancer Conference being held from February 26th through March 1st.
We have to start with a disclaimer, and that is that breast cancer is not a disease, it's an enormous family of diseases. Johns Hopkins did a series of whole genome sequencing on over 400 breast cancers. They couldn't find two that were the same. Wow. And so in dealing with a family of diseases, it's not about the iconic oncologist or surgeon or radiation doctor, it's about the team. And so at our place in Brooklyn, for example, every patient's facts are reviewed by a large team, geneticists, oncologists, radiation oncologists. What we bring to the patient is a consensus. I think the surgeon is normally the front door to that, but not always the first step. I'm actually really happy to learn that you had your medical treatment first.
My chemotherapy.
Yeah.
But see, their doctor is, to me, one of the big impediments. It's like one of the stumbling blocks, because I think that there are so many studies out there that say, we've always done it this way. We've always done the surgery first and the ACT in this order. And therefore, there's this tendency to just make sure that every woman that comes in the door gets that treatment, because that's where most of the studies will give you the success rates. When there might be something brand new out there, as there was 2 weeks before my diagnosis, that I decided to go with. And I think that most oncologists I've spoken to feel that I made a very good decision.
For lots of reasons, I think you made a perfect decision. It goes back to this conference that we're having in February in Miami that you're kind enough to come in and address our doctors. It is so hard to stay current in breast cancer. It's a field that changes week to week, month to month. We'll have more than 1,000 doctors in Miami who want to get it right, who want to do it better. Switching the order, doing chemo before surgery, not only proves that the chemo was the right choice, which it was, it makes the surgery smaller, but if it doesn't work, you change the chemo. And so the studies, I think, are very clear on this type of breast cancer that give the chemo first. And many surgeons resist that. So you and I, Miami, have to change that.
We invite you to register for the 32nd Annual Miami Breast Cancer Conference at gotoper.com/conferences. Sponsored by Physicians Education Resource, the Miami Breast Cancer Conference brings together surgical, medical, and radiation oncologists with the aim of fostering awareness of state-of-the-art treatments and promoting a multidisciplinary approach that improves the care of patients with breast cancer. We hope that you will join us this year in Miami. I'm Laura Jones. Thanks so much for watching Enclave News Network. We'll see you next time.